Okay, let's reassemble. I know it's hard after just a short break, but we should do it.
Whoa.
Yeah, the chairs are a challenge. For those of you in the audience who have not sat in these chairs,
It's a wonderful life.
it's a balancing act. Okay, so we've talked a number of times about this session being the capstone, and what these people have done. Most of them have been able to sit through the entire conference and to reflect and to have things go through the filter of their own minds. So this is in part summary, but it is fresh. And Janet Marchibroda is our moderator for this, and in order not to take time away from her and her great colleagues, I'm just going to turn this right over.
Good morning. It's great to be with you. It's great to participate, have this discussion, the capstone session, because we get the opportunity to sort of share our insights on what we heard, as well as our own perspectives in our areas of leadership. And then also we're, of course, going to hear from you the last 20 minutes, so I'm excited about that. I'd also like to, Jeff, just thank you, thank Jeff Lerner and the ECRI Institute for such a substantive, insightful conference. I've really enjoyed being here, and I'll tell you, it's the first of its kind in sort of looking at the innovations, particularly over the last 5 years or so, that have moved forward and examining what has the impact been and what are some of the solutions. So many of our speakers have talked about the fact, we're undergoing enormous change. Some of the innovations, whether it's health IT and electronic health records or some of the delivery system and payment reforms, and I know Amy's going to talk about that, or even some of the new measurement methods. I know measurement has been around for a long time. We're maybe 5 or so years out, and so we're just beginning to get the returns on the evaluation to understand what the impact is. And we're now in the midst of incredible change. I don't know about you, but it just feels like there is a lot of change going on, a lot of uncertainty. I know our nation's providers, our clinicians and hospitals and plans, and all of us as individuals are really feeling that. And I think that, whether it's telehealth or new ways, more demands on the system from each of us as individuals as we get older and sicker, or pressures on cost. I know we're talking a lot about that at the Bipartisan Policy Center, more focus on transparency. There are a number of things, and not to mention, some uncertainty about the policies, whether it's in the Congress or what's happening in federal agencies. So it's putting a lot of stress on all of us, but good stress. So channeling John Perlin, I loved his remarks about the positive. It's safe to say that this will continue. Over the last day and a half, we've gained a lot of insights. I took some notes around what the challenges are and what the solutions are. In summary, some of Marchibroda's takeaways. This notion of learning, evaluation, measurement, learning, applying our learnings can help us. Of course, communication and champions. The thing that simplification, whether it was Fran Crossan yesterday or John Perlin this morning, simplify. Let's get rid of the things we don't need. Let's focus on the things we really need to focus on. And then, of course, build in resilience, and lead. So those are some of my thoughts. But during the next hour, 55 minutes, we're going to hear from 3 leaders in healthcare. Our first is Amy Bassano. Amy is the Acting Deputy Administrator for Innovation and Quality over at CMS, and in that role, she also directs CMMI, and this is I think everyone in the room knows CMMI, but talk about, experimentation and pilots and evaluation of new innovations. Amy is overseeing all of that, and I'm anxious to turn it over to her. And then we also have Tom McClellan. Tom is on Amy's left. He's the chairman and co-founder of the Treatment Research Institute, as well as he was the senior scientific editor of Facing Addiction in America, the Surgeon General's report on alcohol, drugs, and health, and that was released back in November of 2016. And he's going to apply that lens to our focus here over the last day and a half. And then finally, I'm so delighted that Joe Seldy is with us. He's the executive director of PCORI. Again, what he does is he oversees an organization that conducts considerable research, evaluates what works in healthcare. And what's really exciting about PCORI's work is its unique, really person-centered approach to the research. And he's going to share not only his perspectives as a researcher, but also provide an important patient lens. So this is our plan. So I'm going to ask each of our panelists, starting with Amy here on my left, to share their insights on this overall topic of workflows, workarounds, overworked health systems when it comes to the range of innovations that we've talked about over the last day and a half, and they're entrenched in many of these. And then also offer, if they're interested, some insights, what were the nuggets that they heard as well over the last day and a half. And then we're going to move into some questions and then get to you. So with that, let me turn it over to Amy.